Awesome. Good afternoon or good morning, depending on where you are. Welcome to Silence the Shame's Maternal Mental Health, Getting Back to Work Community Workshop. So we are welcoming everyone into the space. We'll give it about 30 to 60 seconds or so, and then we'll go ahead and get started, but welcome.
If you're here, maybe let us know where you're calling in from. Is it afternoon where you're at? Or it's morning where you're at? I live on the East Coast, but I'm calling in from the West Coast today. I'm so glad you guys showed up. Show up to grow up with me.
Awesome. Yes, I love that. All right. Well, for the sake of time, we'll go ahead and get started. And as folks trickle on in, they will be joining us. But my name is Megan Sharjoy Pringle. I am the creative director for Silence the Shame. We are so appreciative to be able to bring out another community training for you all. And this one is entitled Maternal Mental Health, Getting Back to Work. So in celebration of our Mother's Day, this past Mother's Day, and May is Mental Health Awareness Month. We wanted to do our due diligence and help support families across the world. So we have our amazing facilitator, Angela Harvey, here today with us. I'm going to pass it on over and she will lead you through this amazing workshop today. Thank you.
All righty then. Welcome, welcome, welcome. Greetings and growth to all my babies' mamas and the friends and family of my babies' mamas. I thank you all for showing up to grow up with me through maternal mental health, getting back to work. My name is Angela Harvey, and I was trained and certified by Silence the Shame to provide this needed and necessary training for you all today. So over the past 20 years, I've helped grown folks grow up as therapists, as a motivational speaker, workshop facilitator, and most recently a filmmaker. So just in case you guys are doing the math, that means I started work around age 7. There you go. So this soundtrack for mental health was actually created by Silence the Shame and is the first installation of the Workplace Wellness series. So the soundtrack was created to empower employees and companies to prioritize mental health and well-being. Sony Music Publishing Group, through their Global Social Justice Fund, recognizes that mental health and mental health disparities and wants to lessen the impact of mental illness. So today we will be exploring maternal mental health, which is so very important. So I'm also a baby's mama, and I'm a friend to many babies' mamas. The experience of motherhood at any stage can be the most joyful time in someone's life, but it can also bring about many changes, some unexpected and some straight out of left field. Well, we want to expose some of those left field challenges that can occur so that you can be better equipped to manage your personal and professional well-being. So our fearless leader, Shanti Das, who's a music executive veteran, founded Silence the Shame after the loss of her father and close friends to suicide. So her experience with depression, suicidal ideations, shame, and accessing professional health care was actually her motivating factor to create this nonprofit. And as a result, Silence the Shame was formed. And to eliminate the mental health stigma, reduce health disparities, and improve the rates of suicide amongst marginalized populations, such as communities of color, older adults, children, and more. Fearless, did I say fearless leader? Fearless leader. So the content that we're actually going to cover today can be a little heavy. That along with all the other things we're gonna, that are going on with life, I'd like us to take a moment to be mindful of the reason that we showed up and allow ourselves to be fully present to grow up. So one of my favorite ways to do this is intentional breathing, right? I'd like you all to join me for just inhale. We're gonna inhale for 4 seconds, hold it for 4 seconds, and let it out for 4 seconds. And we're gonna do that maybe 3 times. Deep breathing doesn't carry the physical benefits of exercise or long-term mental health, but it absolutely does do something for the stress. And sometimes, yes, inhaling new information can be stressful, especially if it's something that relates to ourselves or someone that we love. And so we're gonna do this together. You guys are with me, right? Some people can close their eyes. I can't close my eyes. I guess I could. No, I'm not gonna close my eyes. We're gonna do inhale for 4 seconds, hold it for 4 seconds, exhale for 4 seconds. You ready? Inhale, hold it, exhale. Inhale, hold it, exhale. Inhale, hold it, exhale. All righty then. You ready to grow? Okay, so we're going to be reviewing some of the attitudes and cultural differences in maternal health, dispel a myth or two, and explore the impact of being a new parent in the workplace and introduce some tools to manage that transition. So we will include some research-based information in addition to the info from mental health experts, and we're going to share some personal experiences. So we're going to be using the chat room and the raised hand because I want to engage you all. I don't want anybody going to sleep, even though rest is absolutely something that's needed, especially as a new mother. You get it where you can. I want you to share that in the chat room, your primary reason for showing up today. What's your primary reason for showing up today? You're showing up for yourself, you're listening for somebody else, you want to get more information, that type of thing. Those are some of the things that we're going to discuss. Glad that you can do that. Yes. So we're going to go on to slide 5. Maternal mental health refers to a woman's mental health during and after pregnancy. So it's actually a state of well-being which a woman realizes her potential, copes with the everyday stresses of life, and works productively and fruitfully. So all the mothers in the room, guess what? I just said a whole mouthful, didn't I? I want you to realize your potential, be able to cope with your everyday stresses of life, and work productively and fruitfully. So mental health is not the same as the absence of mental illness, but it reflects our capability to adapt and cope. And that's what we're going to kind of focus in on today. Many social factors, including our socioeconomic status, race and ethnicity, the lack of social support, influence a woman's risk of experiencing perinatal mental health conditions, and the likelihood of seeking and receiving adequate treatment. So by the show of hands, how many of you have heard of the baby blues? Baby blues? Yes. Few folks? Okay, the baby blues. The baby blues are actually a period of transition affecting up to 85% of new mothers in the first 2 to 3 weeks after the baby is born. So baby blues typically include emotional sensitivity, crying, feeling overwhelmed. In addition to some of the hormonal changes after birth, those things can actually cause baby blues. For example, you got the estrogen or progesterone suddenly decreasing after the delivery. Those things can absolutely cause, some people call them mood swings. Yeah. And it's not just the mothers that can get them, but males can also experience the baby blues, if you will, because hormone changes during and after the baby's born. So for example, testosterone level may drop, estrogen levels may rise in new fathers. So in addition to other hormones, those hormones can absolutely cause depression. So up to 10%, and I'm going to give you some statistics. In some cases, we kind of tune out when we're talking about statistics, but this is so very important. I want you to, because you easily could be included in that 10%. 10% of partners can have feelings of sadness, depression after the birth of the baby. So it's not just the mother, but the partners of the babies as well. So it often happens during the first 3 to 6 months after the baby is born, but can develop up to a year afterwards. And those are some alarming statistics. Did you know that both men and women, partners, period, can experience some of the same things? So some of our worries or concerns may be rooted in our false perception of parenthood, especially as new parents. So there are several misconceptions about parenting that exist. Can you imagine misconceptions about parenting? Some we have built up through stereotypes and myths. Sometimes we're shocked at the expectation of not being met, and the adjustment to the new reality can contribute to this postnatal anxiety and depression. It's so very, I think that many of us don't believe or don't think that, it's just that we're tired. It's just something, and it's something almost a relief for some people to find out this is a thing and that it is real, and thus it needs to be tended to. So mothering is not intuitive. Yeah, let me stop there and say that again. mothering is not intuitive, and like everything else we learn, it does not necessarily come naturally. I know for myself, I said, I sure hope that when that baby's born, something goes up in me and gives me the ability to be able to show up, you know. I want you just, again, to sit with that for a second, that it's not intuitive and that it doesn't just come naturally. Children do not come with instructions. So developing a relationship with your baby takes time. In addition, particularly after birth, care expectations can be overwhelmingly difficult and make it more difficult for that bonding time. So remember that being a parent is challenging and a stressful job that involves long hours and guess what? Little respite. Like some people right now listening could very well be, you know, trying to sleep because the baby's sleeping, because that's what your mother tell you. When the baby sleep, you sleep, right? But you also have to take care of yourself. So as a result, it may take up to, many weeks for a new mother or father to bond with their baby. Many still expect our fathers, our partners, to be this unemotional rock, you know, someone who can be relied on to deal with the issues as they arise, and to not be vulnerable to confusion or hurt or lack of confidence. However, be clear, fathers and partners play an equally important role in caring for their children and share some of the same frustrations, fatigue, and fears. Sometimes watching you be exhausted can be exhausting as well. And I want you to take, absolutely allow that to resonate with you, that know that it's not just, somebody doing nothing. Couples can often experience unexpected differences in the core parenting values and approaches, which can sometimes cause conflict and tension. In addition, the birth of a new baby can affect the reactive past trauma and feelings of loss and grief. So as a new parent, guess what? It's very difficult. We define this good parent thing as somebody who's on top of it all, doing it right, and absolutely can make us feel like a bad parent. We're going to have one of our experts actually speak to that, being a good parent versus a bad parent and the myth behind all of that. So in slide number 8, women of every culture and age and every economic level can develop perinatal mood and anxiety disorders. We're going to speak a lot about that. Symptoms can appear anytime during the pregnancy and in the first 12 months after childbirth. So in addition, more than 1 of 7 moms, that's a lot, 1 in 7 moms and 1 in 10 new dads experience postpartum depression. And we've all kind of heard of that. Postpartum depression is just as common as postpartum anxiety is just as common as postpartum depression. And many parents experience both anxiety and depression simultaneously. And we don't necessarily think about that. We consider the postpartum depression, which we've heard a lot about, but not the anxiety piece that comes along with that. Postnatal anxiety and depression can be frightening and almost uncontrollable at times. Nevertheless, parents can attempt to manage their symptoms, but of course you have to know the symptoms in order to manage those, right? Let me give you this stat. 40% of mothers with perinatal mood and anxiety disorders seek treatment, never seek treatment. Or no, I'm sorry, that's not true. Only 40%. That means 60% of us, that would include me, did not or will not seek treatment. We have the Black and American Indian and Alaskan Native women have a 3 and 2 times higher pregnancy-related mortality rates, respectively, compared to the rate of white women. Other research also shows that Black and Hispanic women are significantly at higher risk for severe maternal morbidity, such as preeclampsia, which is considered to be more common than maternal death. And that's pretty significant. Social determinants of health disproportionately impacts Black people in low-income communities of color. The conditions in which people are born, live, work, play, worship, even age, including safe housing, transportation, neighborhoods, racism, discrimination, violence, education, job opportunities, income, access to nutritious food, physical activity. All these are opportunities and language and their literacy skills. So who would have thought all of those things come into play when it comes to our maternal mental health? but it's absolutely positively the truth. And I know what you're saying, Angie. On the top of everything else happening in this world and inside of me during this time, I have to deal with all this. Again, knowledge is going to be power, and power is absolutely going to be responsibility. And so you have to know it in order to tend to it. And that's what this presentation is about, you knowing it. So the Center of Disease Control and Prevention says that Black women die in the perinatal period, which is during pregnancy and a year following pregnancy, 3 to 4 times the rate of white women. The maternal mortality rate for Black women has increased from 37 deaths per 100,000 live births to 55.3 deaths in that same 100,000 live births. That's just from 2018 to 2020. So almost 40% of Black mothers and birthing people experience maternal mental health. I'm going to call it MMH. I don't know that I repeat it like that, but just so you know, that's the way it's kind of said. This can include anxiety, depression, post-traumatic stress disorder, obsessive compulsive disorder, bipolar illness. All of this happens during the perinatal stage, but only half are likely to receive treatment. We talked about that 60%. And I want you just to consider you being a part of that 60% or someone you love and care about being a part of that 60%. So then that way you're tuning in a little bit more. Give me in the chat room, and you guys can absolutely feel free to use the chat room as like our little clubhouse, right? And what happens in the chat room stays in the chat room. But there's a lot more information that you all can share. I'm sure there's some people that have experienced some of the things I've already spoken about. Absolutely feel free to share some of those things to engage other people. The scope of emotional illness, we're on slide number 11. The scope of emotional issues and women experiencing during and after giving birth is much broader than just depression. The perinatal mood and anxiety disorder, which we're going to call PMAD, right? PMAD, right? You just say it. The parent is mad. I just made that up. And this is an umbrella term to address the spectrum of mood changes that may occur during and after pregnancy. And under this umbrella are the emotional distresses that include depression, anxiety, obsessive compulsive disorder, bipolar affective disorder, PTSD, and rarely there is even psychosis. Slide 12. Most experienced and even new parents feel that they have 1,000 things to worry about, and that's pretty much the truth. However, if feelings of anxiety interfere with the overall functioning, you may be experiencing postpartum anxiety. And that actually affects approximately 6% of pregnant women, and 10% of postpartum women develop this type of anxiety. Sometimes they experience anxiety alone, and other times it's along with signs of depression. Bipolar disorder is a mental illness with episodes of depression, which are some of the lows, and the hypomania, and that mania being the highs. People that are low, and high, they call that bipolar. Many women are diagnosed for the first time with bipolar depression or mania during pregnancy or postpartum. That's a fact that I didn't know. So as I read over things, I was like, oh, I didn't know that. Depression during pregnancy is called antepartum. And you see how I had to say that, antepartum? I had to get it right. Prenatal depression and depression after pregnancy is called postpartum depression. So approximately 15% of women experience significant depression during childbirth. The percentages are often higher for women dealing with poverty and can be twice as high for teen parents for obvious reasons, because they're not quite developed themselves and they're having to literally take on some of the same things as what we'll call, let's just say, a full-grown woman having to experience. So therefore, they're twice as high for teen parents. 10% of women experience depression during pregnancy, and that's significant. Symptoms can range from mild to severe. Mothers with pre-existing depression before or during pregnancy are likely to experience postpartum depression. Actually, that's much higher. Depression and anxiety are twice as common as expecting and new fathers compared to the global estimates of men. So approximately 9% of women experience postpartum post-traumatic stress disorder following childbirth. Now, you just heard me say PTSD, and many of us think PTSD and we think what? The military, we think accidents. We don't think Yeah, but PTSD can anything that's traumatic, because it's just post-traumatic stress disorder. Anything that can be traumatic can absolutely come with this stress disorder. So an actual or perceived trauma that causes this illness during delivery or postpartum, these may experience intrusive memories and flashbacks of the event. Yeah, I know. That was another aha for me. Post-traumatic stress disorder. Post-traumatic stress disorder. So postpartum, there's also the postpartum obsessive compulsive disorder. Yes, the list keeps going and going and going. This is the most misunderstood and misdiagnosed perinatal disorder. Many mothers experience postpartum OCD without ever having any single previous diagnosis at all. It is estimated that as many as 3 to 5% of new mothers and some new fathers will experience these symptoms. The repetitive, intrusive images and thoughts are frightening and can feel like they have come like out of the blue. However, research has shown that these images are anxiety, not delusional, and have a low risk of follow through. So that's some good news in all of that. Slide 13. Untreated perinatal mood and anxiety disorder seriously impacts parental health and well-being. And I just want you to let that stick for a minute. Untreated is going to be far more impactful than treated. So I'm saying that, and I want to be clear that we know that having something to be untreated is absolutely going to have long-lasting effects on the children's and the families of mental and physical health. Untreated mental health issues in the home may result in adverse child experience, which can impact the child's long-term health. Additionally, consequences of untreated perinatal mood and anxiety disorder includes poor prenatal care, such as poor diet, low weight, skipping prenatal care checkups, smoking, drinking alcohol, or using harmful drugs. Difficulty in caring for and bonding with the baby, and thoughts of harming yourself or harming the baby. And that's big. So when we don't address perinatal mood and anxiety disorders, this may damage a family's stability. Mrs. Maestra shares her experience with PPD.
Child number 2 and 3 are actually 11 months apart. So I had them really close back to back. And I think that during that time is when I go back and reflect where those symptoms that the doctor just mentioned that I was experiencing. And so not only am I going through that, I have a newborn, but also I'm getting pregnant with another one. And it's just like a blur at that point. And people tell you things like, it's not easy, you know what I'm saying, for anybody. You know, like it's gonna just happen. But it wasn't for me. I just kind of felt like those loneliness, anxiety, like I wasn't, you know, kind of doing enough. And really at the end of the day, I felt like equivalent to a bad mother. You know, and I was afraid to bring that up, to mention it. Although my husband was like, you know what, like, I think you have postpartum depression, you know, and that was something that culturally we didn't talk about, something that wasn't really mentioned. We're strong women, you know what I'm saying? So like that idea that I was going through some form of depression, I was not willing to accept. And then it kind of took a snowball effect after I had my third child. After that, it started to become severe, but at the moment, I didn't know it was severe, you know? And that was the thing. In the moment, you don't realize people are telling you, but it's like blah, 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 blah. You just hear noise, you know, because you almost can't get out of it. So I knew that I needed help. Yeah. When I ended up getting arrested because of postpartum depression.
Dr.
So I needed help
go ahead.
When I lost control. And, you know, my family was afraid and they ended up calling the police, you know. And even at the time when I got arrested, I was like, you know what, like, they were like, hey, like your husband's on the phone. He wants to talk to you about your kids. I was like, let him figure it out. I literally remember being numb and just being like, you know, just having zero feelings, you know? And so that's, when I go back and reflect, I think that moment I look at it and be like, that's kind of when I started feeling like, okay, something's not right, but I still didn't know what it was. I just knew I was going to jail.
All right. Whew, that's something to inhale, huh? Postpartum psychosis is rare and more severe than PPD. It typically starts in the first few days or weeks after giving birth, with mood changes including depression, mania, or a mixture of both the two before progressing to psychosis. Depressive psychosis can lead to maternal suicide, infanticide, or both. Suicide accounts for 20% of postpartum depression. Maternal suicide within the year of birth exceeds hemorrhaging and hypertensive disorders, such as the cause of maternal mortality, and is probably most underreported. Suicide is one of the leading causes of death in women in the postpartum. Yes, did you hear me say that? Suicide is one of the leading causes of death in postpartum women. Yeah. Major depression, bipolar disorders, alcohol and substance use disorders, schizophrenia, anxiety disorders contribute to the increased risk for suicide and suicidal behaviors. In addition, mothers with suicidal symptoms display reduced responsiveness and sensitivity to infant cues. Their infants have less positive effect and reduced engagement with their mothers. So in addition to psychiatric disorders, other risk factors for suicide or suicidal ideation in adults include a history of self-harm or suicidal attempts, suicidal thoughts, a family history of suicide, and increased level of hopelessness. And I know what you're saying, because I've been saying it too. Like, who thought that we needed to talk about suicide when we talked about maternal and giving birth to babies? But it absolutely is a truth. And keeping in mind, knowledge is power, and that power is going to be something that saves someone's life. So let's hear from the experts. We have Dr. Abrams, a licensed clinical psychologist, and she's also the founder and executive director of Ascension Behavioral Health. She's going to provide some insight regarding shame and guilt and how we can prevent us from getting the support that we need.
Is the shame and the guilt that comes up, right? The bad mom theme, right? That in me not being able to do this or not look like how media portrays this or how social media portrays this, that there's something inherently wrong with me. And nobody wants to talk about that, right? That's the shame that comes in and really turns a lot of new parents inside themselves, and then things can get progressively worse from there, because then we're not sharing, oh, I'm having these thoughts of this. Oh, I'm feeling really worried about this, right? Oh, I'm feeling disconnected from myself in these ways. We stop talking about it, right? Because it doesn't feel as though there's a safe space to even honor any of that, because you're going to get people in your life who say, well, that's normal. That's what this looks like. Right. Every mom goes through this, right? So then it's like, well, why talk about it if nobody's going to help me with anything and nobody's going to validate what I'm experiencing? That's one of the hallmarks that can really turn, again, baby blues into a full-blown depressive episode, right? For a lot of new people, not having the space outside of them to even feel safe enough to say something's not well. So it begins showing up in our behaviors, and that's what you were talking about, right? So even if I wasn't acknowledging this, it's manifesting in these ways, right? And oftentimes something else or some other entity is the one that helps us kind of stop engaging in those patterns, right? And depending on what our support system looks like, if we have people in our lives who can recognize some of those symptoms, they might be the first ones who say, hey, is something else going on here? And is there something I can help you with, even if we're not able to do it ourselves, right? So ideally that would be a close family member, if there is a shared parent in the situation, or a medical provider, right? Because that's oftentimes the only people who we're seeing at that time, right? And that's what's also different about navigating this in a pandemic. Our social support system is totally different now in terms of how we're used to accessing them. So really wanting to pay attention to the isolation and the silence that comes with this, on top of, you mentioned so many things, the cultural piece that comes in, right? That how am I already expected to do this, right? And am I performing this role properly, right? Versus recognizing that, hey, this is a psychological event. This is not just physical, right? This is changing the way in which I know myself, the way in which I see myself. And do I have spaces to fully honor that? And if I don't, again, that's where we might see some more of those depressive symptoms begin to show up.
All right. So by the show of hands, or you can go to the chat room, and again, what happens in the chat stays in the chat. How many people have felt some of that? And not necessarily the full-blown thing, but being that bad mother because you're not able to experience all of what is happening with you, all that is happening with the baby, all that is happening with the world. I'm overwhelmed just saying it. Those things are absolutely, positively true. And if nothing, I want this to validate for some people. I want this to be validating for some people to know that this is a thing. It is real. And here we're going to talk about some more, a little bit about it, but also some things that can be done about it. I definitely want this to be affirming, and as affirming as it can be. Some women are more sensitive to hormonal fluctuations during pregnancy and postpartum. Women with a history of severe mood challenges around their menstrual cycles, or when the hormonal birth control, may be more sensitive to hormonal shifts and therefore more predisposed to developing a perinatal mood or anxiety disorder. Knowing the risk factors and the perinatal mood and anxiety disorders is going to be critical. Keep in mind, knowledge is power. So you having the knowledge is what's going to give you the power. Other risk factors for developing perinatal mood and anxiety disorders include past depression or anxiety, especially around a prior pregnancy. Recently stopping your treatment for anxiety or depression, and a family history of mental illness. In addition, social isolation from family and friends, because we tend to go inward, especially when we have that bad parent thing and we feel like we're not doing it all. If we can't look good when the friends come over, you know, those types of things, we find ourselves isolated. Being a single mother, if you have an intimate partner conflict, low self-esteem, financial stress, prior pregnancy loss, birth trauma, medical complications for a mother or for the baby, struggling with breastfeeding, and sleep deprivation. Did I say sleep deprivations? Yeah, we all know about that, right? That's one thing we can all say we experience. These are all contributing factors. So currently, there is no known way to prevent perinatal mood and anxiety disorders, but rest assured, there's some things that can happen. Again, that knowledge and being aware, knowing the signs and symptoms to watch for during an active pregnancy can help you prepare to get help sooner. So here are some things that you absolutely can do. You can find out whether what the factors are, and if you have any factors that would hold you at greater risk. Talk to your healthcare provider about some of the risks, the signs and symptoms, and do this beforehand. If you know, if you're watching or you hear this at some point, these are absolutely things that you can bring up beforehand. It doesn't have to happen for you to begin to get some information about it. Learn about pregnancy and childbirth and parenthood. Know that we didn't talk about these things 10, 15 years ago. I gave birth to my daughter 30 years ago. These were things that we didn't talk about, and these were things that were happening all along. And so just know that we've come a long way, but we still have a long way to go. And you being improved in your knowledge is absolutely going to be helped. Set some realistic expectations for yourself. You're not going to be able to clean the house and feed the baby and take care of the other kids and answer all the emails and go on. So yeah, that's not going to happen. Develop a social support, and this is so important. I definitely encourage everybody listening right now to develop a list of things that what people can do to support you. Because sometimes when people say, how can I support you? And we say, you're just too overwhelmed to know. Think about those things right now. What can you do? What can someone do to support you? And also think about the things that you can do to support other people. The screening for this perinatal mood and anxiety disorder is the first step to educating women about the risks and the signs and symptoms to detect these potential conditions, because there isn't yet a medical diagnostic test like a blood test or a saliva test to see possible mental health disorders. There are questionnaires and things like that that can be used. There's one by the American College of Obstetrician and Gynecology, and this recommends the universal screening for depression and anxiety for all women as a part of your routine gynecological care. And so I want you to be aware of that. It should be something that happens just because you are pregnant, just because you're expecting, or because you've just given birth. There's also the perinatal mood and anxiety disorder screen, which is an evidence-based tool such as the Edinburgh postnatal depression screening. Yeah, I got that right. After administering the screening tool, the score is then derived and to determine if someone is at risk of a mental health disorder. However, a positive screening score does not necessarily confirm a diagnosis. A more thorough diagnostic evaluation by your healthcare provider with adequate training for maternal mental health may be necessary. So at minimum, a screening should occur at least once, ideally late in the first trimester and early in the second trimester, at least once at the 6-week postpartum visit, and ideally at least once additionally through the first year after birth and within 30 days of the initial positive screen. So we got at least 1, 2, 3, 4, 5 times that screening should occur. And guess what? You don't have to wait on somebody else to give it. You absolutely can ask for it. And I definitely encourage you to do just that. Emotional stress and perinatal mental health disorders are treatable, right? Unfortunately, the increasing awareness of this rare perinatal mood and anxiety disorders and the potential negative impacts on mothers and babies and families, perinatal mental health is too often underdiagnosed, undertreated, or not treated at all. So this knowledge that you're getting right now is so very helpful to it being something that can be treated. Many treatment options are available for depression or anxiety during pregnancy or after birth. Some women may participate in counseling, others may need medication. Unfortunately, there's no one single treatment for what works for everybody. So there's no one fix, no one thing can fix everything. But women can take medication during pregnancy and breastfeeding. Several medications can treat depression and anxiety effectively and are safe for pregnant women, breastfeeding women, and their babies. So talk with the healthcare provider about medications that may be right for you. Psychiatric illnesses and psychotropic medication pose additional risk to the mother and to the fetus. Recovery from mental disorders and substance abuse disorders is a process, and it's a process of change to which individuals can improve their health and wellness, live a self-directed life, and thrive to achieve their full potential. Recovery is an intentional series of steps to improve your health, maintain a stable and safe environment, and build social support and engagement in meaningful activities. So let's hear from another expert. We have Dr. Abrams. She's a licensed psychologist and founder and executive director of Ascending Behavioral Health.
So early intervention is always key, right? When you begin noticing those things, that's the time in which you can start processing. Oftentimes we wait for a certain kind of severity of distress in order to then determine like, oh, well, now's the time in which something needs to happen. Like it needs to get bad enough versus being able to implement those things as soon as possible, right? So when you begin having a thought that feels uncomfortable, that's when you can talk about it. You have full permission to talk about it right then, because what happens in that waiting is that you develop this new practice of, oh, well, that's just common. That's a thought that I had yesterday, right? And then it builds and builds and builds because there hasn't been any other processing of it. So you want to do something as soon as possible. That when I'm having this thought, again, it doesn't make me a bad person, a bad parent, a bad mom, a bad partner, a bad family member, but this is normal and common, and I'm able to ask for what I need in this moment, right? And again, and when that feels really hard for you, that's actually a cue that says, I need some help. Yeah. I need to tough this out. It's hard, but I got to figure it out by myself. That's actually the exact moment when say, this is hard. I don't have to do this alone. And if I don't have access in terms of my immediate support system, there is somebody else who has navigated this that I can reach to, right? Again, the shame and the silence will have us tell ourselves this myth that nobody else is going through this the way I am. I am so unique in this. I'm the only one who's navigating this at this age, in this county, in this, right, in this school system, versus there are so many birthers who are navigating this, but we don't know it. We don't know it because nobody's talking about it.
Right, and that's so very important to remember that definitely there are many people experiencing this, and the more knowledge that we have, the better. So transitioning back to work after prenatal leave, look, I'm trying to leave, and I wanted to say absence. There are some logistics to be put in place, like childcare, right? Very important. Coordinating schedules with your partner or your family members, making a pumping plan if you're planning to breastfeed, in addition to the range of emotions you may be experiencing, from anxiety to the anticipation of guilt. And yes, that can happen when you first leave the baby. We're going to talk a little bit about that too. Slide 22, everything is changing. We already know that everything is changing, from your practical day-to-day schedule to your new responsibilities as a parent, to your identity regarding how you see yourself, how you saw yourself. About 30 to 45 days before you return to work, you should begin preparing the expectations for this new role as a new mother, return to work with additional responsibilities. Make a list of what you and your baby will need. Again, I will say to you, make a list of those, not just what you need, but how other people can support you, because there are other people that will support you, but they need to know almost specifically what they can do. Start by reflecting on your goals. Then before returning, think about how you can best contribute to your organization. Finally, consider what you need to do to fulfill your responsibilities and foster your career in a way that allows you to be a good parent as well. So sometimes some things to consider as you are preparing to return to work, or decide if you want to return, because for some people that's an option. You want you to realize the transition is going to be right. It's going to be fine. It's going to be ongoing, right? This transition is going to be ongoing. You make a list of what you get from your job, including like your paycheck, that part. Make a list of what you bring to your workplace. Acknowledge your new learning curve, like you get in there and you'd be surprised in any company what types of things change in those months while you're away. Right before you return, sit down with your manager, discuss some of the goals and successful transition and what that looks like. Many people do not do that. And these are things that you can do to assist you in your own care, is discussing things beforehand, right? Discussing professional development, what your goal is, how you might want to reset that. All those things can be talked about ahead of time. Some of the questions that you might want to ask is, will your job or responsibilities look the same? You know, there's nothing like coming back to something besides you coming back to 1,700 emails, coming back to a new changed responsibilities or workload, or someone else you need to, to hire. Any of those things can happen. So you want to ask those types of questions. Is there opportunity to phase back into your normal workload, especially during that first week when the adjustments are going to be just huge? Be prepared to redefine your expectations for yourself and make adjustments on how you can do your job and do it effectively, both your job at home and your job at work. Find out if your employer has resources for new parents. Seek advice from colleagues, right, that have been through the process. They've been through the leave, go to work, come back, and what that looks like. Take in all the information you can. Slide 23, be in communication with your boss in the weeks leading to your return, if you can, and if it's comfortable. Consider your schedule, and instead you can return part-time and maybe, think about easing into that role and what that looks like. If possible, schedule a return to work in the middle of a week, like on a Wednesday, Thursday, so that way you can work a couple days and then have some time off. A midweek start actually allows you more time to adjust a little bit more slowly versus you going full in on that Monday. And even when we're not having children, we think about Monday and we can't wait to what? Friday, right? I imagine that's double the impact when you're having to experience all the things that we've just talked about. So that 40-hour work week could absolutely shock your system. I want you to be mindful of managing relationships with colleagues as you set into your new work life. Many parents return from work with the mindset, I'll figure it out, or I'll just adapt. And that can be risky. So you want to get as much information as you can and have a transition plan. There's nothing wrong with being fully prepared. In fact, I will tell you that being prepared is the best way to be in the best mental health that you can have, is to be prepared for the things that can happen. All significant transitions take some adjustment. The emotions can come like a flood, right? For example, you may experience separation anxiety from being away from your baby after so much time together. And of course, working mom guilt, that's real. Feeling inadequate and unable to measure up at home or at work. Uncertainty is also a common emotion at this point, especially about how often to check in with your caregiver. Like, doing it all the time. So if you're struggling with mental health, seek professional help sooner than later. Don't wait until you can barely get out of bed, or till you can, the minute you go, that's not right. The minute you feel something, the minute somebody else maybe says something to you like, hey, did you know that you did X, Y, and Z? The minute you hear those things, I want you to consider getting help. There's nothing wrong with getting help, and there's definitely something very sexy about getting help sooner than later. The transition back to work can be overwhelming if you're a new parent. So you want to try some of these tips to ease into maybe bringing the baby to work if you're comfortable with sharing your work life. Sometimes it can help your colleagues to understand, like, yeah, she is a new parent. Because, sometimes we come back to work, we're all, beautified, and the people say, oh, you don't even look like you had a baby. Well, when people say that, they don't recognize that you got this little one at home. So sometimes bringing that baby in with all the bags and stuff kind of helps them to go, okay, then she just had a baby. So many parents feel like they lose the last few weeks or even months of their maternal leave because they're looking forward, right, and are focused on what will happen. I want you to try to stay present as best you can, but planning to do what you need to be mindful about that. Consider joining the parenting group. That is absolutely that support that you get, the knowledge that you get, and not just that, the knowledge that you can give can absolutely be instrumental in your mental health and well-being. Learn to be okay with the tasks and schedules taking longer than before. Yeah, before you did them in 2 minutes. Now with kids, you're doing them in like 17 minutes. Prepare to live with the uncertainty and be more flexible with your expectations. Show yourself some grace. That's going to be so very important. Learn to reframe. Being a parent doesn't limit your skills, but on the contrary, it improves your ability to multitask. And you have to inhale that in the best way. It gives you more abilities, but you have to use them to know that they're there. So if you or someone is experiencing severe or distressing symptoms that have lasted 2 weeks or more, don't wait until your symptoms are overwhelming. Instead, discuss these concerns with your primary care physician, who you can refer, or they can refer you to a mental health specialist if needed. Mental health services may be available to you through your healthcare insurance plan, and you should absolutely talk with your HR or your insurance company about learning some of the coverages and the options that you have there. So I am hopeful that this maternal mental health soundtrack has helped you with your rhythm, and that you feel able to keep up with the beat and stomp out the stigma and silence the shame. We invite you all to follow Silence the Shame on all social media platforms. And I thank you all for showing up and growing up with me. It has truly been my pleasure. And until we meet again, I want you to create an amazing week for yourself, and keep your mind sound and your awareness on track. Now, if anyone has any questions that I might be able to answer, you can feel free to drop those in the chat. I would be most gracious if you did. If you have any questions or any comments you'd like to leave, that's great as well. And again, I want to thank you all for showing up. And I want to thank Megan, who had to help me along there. But that was great. I absolutely can appreciate that. Any questions? Megan, you getting feedback from people? Oh no, I don't. I can access that, can I? Right.
Not yet, but everyone, please feel free to enter your questions into either the Q&A function or into the chat function.
There you go.
I am also going to go back to this slide. Please feel free. You can take a screenshot of this. That way you can share the many resources with yourself as well as any loved ones or anyone in your network. So please feel free. You can take a picture with your phone or screenshot it on your computer.
And again, thank you all for showing up to grow up. Definitely appreciate you.
Awesome. And if there's not any other questions, then we definitely thank you for your time today and hope that you've enjoyed, again, our community training, Maternal Mental Health, Getting Back to Work. Please stay tuned for additional trainings that are coming your way, and sign up for the STS newsletter to keep yourself updated with those. And thank you, Ms. Angie, for being our awesome facilitator today. And thank you everyone for joining us.
Thank you.
Have a Thank you. Have a wonderful Wednesday, everyone.